Hi everyone, I am Dr. Karthika Krishna Kumar, Consultant Endodontist and Director at Metier Multispeciality Dental and Polyclinic, located at Vidyaranyapura, Bangalore. What is root canal treatment? A root canal treatment is the name of a dental procedure that cleans out the decay in your tooth, pulp and root. Your teeth has an enamel layer, which is the outermost layer of your tooth. The second layer is a dentine layer. Beneath it, that is the third layer, is a soft core layer which consists of your dental pulp, which has certain blood vessels, nerves and connective tissue. When decay gets into the soft core, that is the pulp, it becomes inflamed and gets infected, and also sometimes necrotized, that is the pulp gets dead. During a root canal procedure, your dentist will extract the bacteria, that is remove the dead pulp or the inflamed pulp, and clean the entire pulp area, that is from the coronal pulp to the radicular pulp, and clean it using certain chemical agents, and fill the empty root with a artificial or a synthetic filling material and seals the root canal from further infection. The only way to know whether you need a root canal is by paying attention towards your symptoms and signs. If you notice any of the warning signs or symptoms, it is important to see your dentist and get the tooth treated as sooner as possible. The early the treatment, the better is the outcome. Some of the few symptoms are persistent pain. That is, the tooth is having severe pain and it is persistent pain is one of the signs that you might need a root canal. The pain in your tooth might bother you all the time, or it might go away from time to time but always returns. You may feel pain deep inside your jaw or your jawbone of your tooth. You may also feel referred pain towards your head, neck and your throat. Tooth pain may be also of other causes which might not need the root canal. Certain possibilities are a cavity, a gum disease, a referred pain from other infections or other problems, dislodged filling which will cause sensitivity to certain extent due to the food lodgment, also a wisdom tooth which is impacted inside your bone causing an infection. No matter what is the case, it's a good idea to see your dentist if you have a tooth pain, especially if the pain is persistent. Early diagnosis and treatment for the tooth pain typically leads to a better outcome. Next is the sensitivity to heat and cold. Does your teeth hurt when you have food or drink hot coffee or cold items? Or perhaps your tooth feels sensitive when you eat ice cream or drink an icy cold water. The sensitivity could feel like a dull ache or a sharp pain sometimes. You may need a root canal if the pain lingers over an extended period of time even after you remove the stimuli. If your tooth hurts when you eat or drink something hot or cold, it may be an indication that the blood vessels and nerves in your tooth are infected or damaged. Next cause is the tooth discoloration. An infection in the pulp of your tooth can cause your tooth to become discolored. Trauma to the tooth or a breakdown of the internal tissue can damage the roots, give the tooth a grayish black color or the appearance. Tooth pulp die when there is an inadequate blood supply due to strangulation of your blood supply, then thus signaling a possible need for the root canal treatment. Although this tooth discoloration can also be because of other causes, it's always a good idea to see your dentist if you notice the color of the tooth is changing. Next is the swollen gum. Swollen gums near the painful tooth can be a sign of an issue that requires a root canal. The swelling may come and go. It may be tender when you touch, or it may or may not be painful to the touch. You may also have a little pimple on your gums near the tooth which is infected. This is called as a gum boil, paralysis or an abscess. The pimple may ooze the pus out from the infection, and this can give you an unpleasant salty taste in your mouth and make your mouth smell bad. So in such cases, you might need a root canal. Or before root canal, there might be a chance the pus is drained out by the dentist, so that you will have a relief in your pain. The next is pain when you eat or touch the tooth. If your tooth is sensitive when you touch it or when you eat, it could indicate severe tooth decay or a nerve damage, which may need to be treated with a root canal. This is especially the case if the sensitivity persists over time and does not go away when you stop eating. The ligament around, that is the fibers around the tooth structure or the root tip, gets infected and becomes hypersensitive. The waste products from the dying pulp may also irritate the ligament fibers, causing the pain while biting pressure is given. Next is a chipped or a cracked tooth. If you have a chipped or a cracked tooth in an accident or a contact sport, or by chewing on something hard. The bacteria can set inside the tooth and cause inflammation of the tissue and cause an infection. Even if you injure a tooth but do not have a chipped or a cracked tooth, due to the certain impact of the injury, the damage of the nerve can happen by itself, and the nerve can get inflamed and cause pain or sensitivity, which may require a root canal treatment. Next is tooth mobility. When your tooth is infected, it may feel looser. This can be caused by other factors besides pulpal necrosis, and acidic waste products from the nerve death can soften the bone which is around the tooth and lead to the mobility of the tooth. If there are more than single tooth which is mobile, it could be a cause of other infection other than which may require a root canal. Therefore, an infection inside your tooth pulp and the root causes discomfort and pain. If you have these persistent tooth pain or other symptoms, see your dentist as soon as possible to get a correct diagnosis and a correct treatment. Thank you.